Hello everybody and welcome to Protector of the Pack. I'm Dana Hoffman with Guardian Canine Training, and today we're here with Lisa Allmiller with House Paws Mobile Veterinary. It's nice to meet you.
Nice to meet you. Thanks for having me on.
You're welcome. So tell me a little bit about House Paws, how you got started and how everything became what it is today.
Okay. Well, we started about 6 years ago, and I actually started because I lost my job. I was working at kind of a more corporate-oriented veterinary hospital, and I wasn't probably following like the one-size-fits-all rules with most of the, well, not with most things, but that sort of thing. So I think our last conversation was, I'm your boss, you're going to do what I say, and mine was, no, our boss is the client, whatever, if you want to do what makes the client happy.
Right.
So that made me just think like I need to go and, instead of finding a place that I fit in perfectly at, like just start my own thing. So
start fresh, right?
Yeah. So I had a stethoscope and a Pacifica and a microscope. So
and a dream, right?
Yeah, pretty much. So I just started like that, and I'd been in the area a long time. I originally worked at William Vet Hospital. Loved that hospital. The owner was great. He was a great mentor, and had been serving pets in the area for a long time.
Awesome.
So word of mouth just kind of spread. Facebook, social media.
Yeah, Facebook, it gets out there on that for sure.
Yeah, it does. So I think the first 6 months I worked alone and used the tech here and there as needed for like rough animals, like animals that needed like a second hand.
Yeah.
And then by that January, like 6 months later, we had our second vet come on part-time.
That's awesome.
Yeah, and now I think we were just talking before the show, but we're going to have 13 vets as of this summer.
Wow, so you went from 6 years ago just being yourself to almost now 13 vets.
Yeah, 13 vets and about 52 support staff, yeah.
52 people in the staff in 6 years.
Yeah.
That's awesome. When you started this company up, what did you expect? Did you expect this? Did you hope this? What did you think?
I thought I'd have more time for my kids, and I'd be able to go to all their stuff.
Yeah?
I remember telling my husband, I'll have plenty of time to like work my schedule around their games, and he said, you're going to be busier than you can imagine.
And you were still saying, no, I think I'll be all good.
I'll be totally in control.
And it just took off like a rocket ship pretty much.
Yeah, I mean, people really want, people are busy. They really want good service. I think a lot of people feel like they're missing good service anymore, and they feel like they're rushed when they're going for service. And they really like the idea of someone coming to them in a quiet environment, like which is their home instead of a busy office,
right? And
getting one-on-one personal service where the vet's not leaving 12 times during the appointment, like rushing out to get something. Like when we're with them, we're like this the whole time. Like I can maybe run the car for something, but typically they're with the vet like for 30-40 minutes of their appointment, which a regular hospital visit is not like that.
You feel like they get rushed, is what you're saying, and they're not getting the full one-on-one service that you feel like the pet and the client need.
Yeah, I mean, the hospitals I used to work at, the technicians would come in, take a history, they would get your shots and stuff ready, they would trim your nails, whatever, draw your blood, they leave, the vet comes in, does like a 5, maybe 10-minute exam, pretty quick exam, then leave, and then the technician comes in and gives them their medicines and their instructions. So they spend a lot of time with the support staff and not a lot of time with the vet, so they do, I think, feel a lot of people walking in and out, whereas, and then if they have to wait in the waiting room or if they wait at reception, like the whole experience, I think, is kind of stressful.
Right.
Whereas at home, if we're late, if I'm running 45 minutes late because of traffic,
they're at home
They're at home, the pet's fine, they're making cookies.
So you just feel that it's a better experience for everybody from what you have seen.
I think so. There's less chance of contagious disease.
Well, that's true.
And the biggest thing is we get to see the pet in their natural environment. So we get to see like where they're going to the bathroom and where they're eating and what they're eating.
Right. That helps.
What's in their cupboards? If we see, when I see a new client, I'm usually saying, what do you, they show me what they're eating, and if they have like treats from China, we're talking about that and pulling it out.
Right.
Or, bones that are going to break teeth. We'll warn them that those bones can break teeth. You should use X, Y, and Z instead. So I hate to use the term holistic, but holistic means treating the patient as a whole. Right. And really, home care is the best way to be holistic. You get to see where the cat's pooping.
Right.
You get to see the stress in the house, with smells in the house.
That can indicate something that when they're coming to, let's say, a facility, you can't view any of that. You can't see any of this to understand. So you're basing a diagnosis based on what somebody's telling you and not being able to see, is what you're saying.
Yeah, like I was in a house the other day and the cat's had chronic vomiting, like its whole life it's had vomiting since it was like 1. And it's been to several vets and we were like the sixth opinion or whatever. And when I came in, the lady had a smorgasbord of food. Like she had like 7 bowls of different foods laid out.
Wow.
All piled up to the top.
So so there's the issue.
Yeah. Now if she came to the hospital, I might have said, what are you feeding? And she might have said, oh, like, he's picky eater, so I vary sometimes this, sometimes. But I never would have pictured in my brain how she answered that question, probably being like, oh, I leave out 7 bowls to the max, some wet, some dry, offered every day. Like, you won't get this sort of answer. Like, sometimes what people communicate
isn't really reality.
Yeah. They might be saying it correctly, but it's not what you're picturing.
Right.
But they're not. It's just not being communicated very clearly.
Right. So
and now I know to ask, like, when are you feeding those foods?
Right.
Like,
yeah. All times during the day or once a day. That's awesome. So I could see that really helping as far as making a better diagnosis and being able to help people help their pets that aren't feeling so well. I can see how that's an excellent idea. Yeah,
and like you with home training, like if we go somewhere and the pet, is having anxiety. Like, we get to see the backyard, we get to see their exercise routine. Like, you see that they have, maybe a collar on, and they don't have any roaming ability. They don't walk the pet.
Right.
So the pet's chewing its arm and has a lick granuloma from anxiety. Oh, well, we just open the door and let him go out. Will you take him for walks? Nah. No, we don't take him for walks.
Right. So he's not expending that energy and getting it out, so you're able to see in the home what could be causing it, which is great.
Yeah. It's hard for a dog to stay inside, 6-foot fence with no vision, and just in a small house. Like and I try to tell people like you probably do too. They have a roaming instinct that they have to satisfy. Like, they need exercise beyond just playing in the backyard.
Right. Exactly. I completely agree with that. And what we're going to do right now is we're going to take a quick commercial break. When we come back, we're going to talk about a little bit more about some tips and that you can maybe give our viewers about things that they can do to help keep their pets safe in the homes. And we'll be back in just a few minutes, and we'll see you in a moment.
You can't predict what a pet will bring to your life, but with a plan in front of you and veterinary pet insurance behind you, you're ready for whatever comes your way. With VPI, you're ready for anything.
Ready for anything.
When we make Beyond Natural dry dog and cat foods, we start with real meat as the first ingredient. We leave out corn, wheat, and soy. And we own where our dry food is made. 100%. Can other brands say all that? For nutrition you can trust and your pet will enjoy. Does your food go beyond? Learn more at purinabeyond.com.
Simply Gents, located in Marlton, New Jersey, takes care of all your grooming needs, including haircuts, straight razor shaves, massages, facials, manicures, pedicures, and waxing. To find more information or book an appointment, visit us online at www.simplygents.com. The secret weapon of a well-groomed man, Simply Gents.
When it's time for Jersey Mike's to give a sub some sizzle, this is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
Today's show was brought to you by Alicia Kelly of White Horse RV Center in Williamstown, New Jersey. Alicia is your RV expert. Contact Alicia at alicia@whitehorserv.com or give her a call at 856-262-1717, extension 203. When you think of RV, think Alicia Kelly.
Hi everybody, welcome back. We're here with Protector of the Pack. I'm Dana Hoffman, for those of you just tuning in with Guardian Canine, and this is Lisa Allmiller, and we had left off where we were going to start talking about prevention for your pets, such as heartworm prevention, ticks. So we're going to speak with Lisa here about some of our upcoming and most popular preventions.
Well, I think prevention, we're a very big preventative practice. Like, it's important for your pets that you're not always chasing disease, that you're actually like thwarting it. So definitely, I think most people know this, but pets under 6 should be seen once a year. Pets older than 6 usually should be seen twice a year, just to catch problems early. Certain breeds, you should know your breed, but for instance, bulldogs get stones, crystals and stones, and some other small breeds do too. So getting urine samples once a year, I think a lot of vets don't recommend that, but if it's a small breed that has urinary problems in their like Bichons, bulldogs, a lot of the small ones, get urine samples before you get the bladder full of stones.
Right.
This time of year, of course, actually in New Jersey, ticks are always a problem. Ticks are always a problem. And parasites are always a problem,
yes.
Like whipworms, because New Jersey has sandier soil. So once a year, your pets should get a fecal test done. If they are out a lot at dog parks or they go to doggy daycare, they should probably get a fecal done twice a year for their safety. As far as heartworms and stuff go, I didn't see a lot of heartworm before, maybe like 10 years ago, but the thing that's happening now is a lot of pets are coming up from the south in rescues.
Yes.
They're bringing a lot of pets up from the south, because up here it seems like we're handling our pet overpopulation a lot better. But in the south, they're still having a lot more like kill situations. So
right.
Rescuers are bringing pets up that are loaded with heartworm. So, this year so far we've seen 2 pets that were not rescue pets with heartworm.
Oh wow.
And I think it's a little dangerous. And I consider myself, like I said, holistic, and I try not to do a lot of stuff I don't need to do, but at the same time, I think it's a real threat in New Jersey. Not as bad as Florida, but
yeah.
I do think pets should either be on a heartworm prevention once a month, which also deworms them from intestinal parasites.
Right.
Or you have to find out what's a good equivalent, and there's some great herbs that help, now I'm blanking, but black walnut is really good, is a good natural herb that helps clear parasites. So
all of them or just some?
Well, they use it a lot for heartworm, heartworm
wow.
prevention. Unfortunately, there's no studies on that stuff, so if
it's
you work,
gamble pretty much.
Well, if you work with a holistic practitioner, they're going to give you the doses and stuff like that they've always had luck with.
Oh, okay.
Minimally, because I have some clients that don't like to give their pets that heartworm prevention, or they've had reactions to it.
Oh, okay.
Minimally, you have to get your pets tested every year for heartworm and tick disease, because if they get it, we can treat them before they're sick with it.
Right.
So prevention's really, really huge. And I think, one of the things that we do is we look at the pet as each pet is an individual. So I have 4 dogs.
Right.
2 of my dogs don't take heartworm year round. 2 of my dogs do. 2 of them prance out for 2 seconds, pee, barely touching the ground, and then prance in.
Right.
One of them has autoimmune disease, so I don't do, I pretty much try not to give him anything.
Right.
And the other one has had allergies to medications like that.
Geez.
So, but luckily they're not the ones that are out. My 2 larger dogs are out, dog parks, running and playing, off leash in the woods. So, those 2 are on heartworm year round, and they're on flea and tick, year round. And I think the flea and tick thing is a big thing for people because they're scared about their kids touching it. They're scared about reactions that they read about on the internet.
Right, that can be scary.
Yeah. The biggest thing is you should have a relationship with a veterinarian you trust that's going to recommend products, natural or otherwise, prescription or natural, that they see working for pets. I don't recommend anything over the counter like Hearts. I forget the name of the other one, but BioSpot.
Yeah.
There's a generic Frontline that they sell at Walmart, but the
Yeah.
spreading agent doesn't seem to work. So the active ingredient's the same, but the spreader doesn't work. So it doesn't.
Oh.
So we still see ticks at one side of the body,
Oh,
but they call
wow.
it the generic frontline. I forget the name of it, but that doesn't seem to work. We see really bad heart reactions and bio spot, especially with cats, like where they seizure and stuff.
Oh, I can only imagine, yeah.
Yeah. If you buy the stuff online, it's not guaranteed through the drug companies don't sell it to online pharmacies.
Oh, okay.
So if you buy it from like Pet Meds or something like that, you should check the lot number and you should make sure that it's a legitimate product, because they have had products that are counterfeit. Some things are coming from other countries.
Oh, wow.
Yeah, and actually, if you ever go to the FBI museum in DC, they actually have like a whole area of counterfeit products, and one of the things they have is like all the displays of the flea and tick products, like Frontline, Heartgard, and stuff that you can get counterfeit.
That's awesome.
They look
I've
exactly
never
the same.
heard of that, so that's really good for people that are watching. I know tons of people order off of line, so what Lisa's telling us here is be careful of, buying your pet products such as the Frontline and Heartgard. Is that one of them as well? Online?
Well, you can get almost anything online, but basically the drug companies that sell like veterinary products don't sell to those companies. They sell to veterinarians.
Oh, okay.
So either I'm a veterinarian who buys a whole bunch and sells it to them because I'm trying to get a quick profit,
Okay.
or they're getting it some other way. But basically, if you buy it from your vet, like for instance Frontline, I'm pretty sure they still have this deal. If you buy it from your vet and you still have fleas after 3 months, they'll send an exterminator to your house. Like so,
Oh,
if you buy it
wow.
from the vet, the drug companies will back you up.
Okay, but so
if you
don't
buy
do
from Pet
online if
Meds,
you can.
If you buy it from Pet Meds and they get whipworms, say you get Heartgard from Pet Meds on whipworm, they're not going to, Marielle is not going to pay for your whipworms.
Oh, okay.
If you buy it from me and your pet gets like roundworms or whipworms or hookworms,
They'll back
they're
up
going to
their
pay
product.
for the treatment.
Oh,
yeah,
that's
they're
awesome.
going to pay for the treatment.
I can guarantee you that the majority of people don't know that. I mean, I was in the veterinary industry for many years before I started my company, and I wasn't even aware of that. So
Yeah.
that's something that I'm sure most people aren't aware of that. So please, if you're going to buy things off of the internet, like Lisa was telling us here, just be careful because they could be counterfeit. So if you can go to your local veterinarian or to House Paws and order from somebody that's getting it directly from the manufacturer, you're a lot safer and your pet is less at risk to get these infections and parasites that they're supposedly protecting against. That's really good information. And what we're going to do is we're going to take a quick commercial break, and when we come back, we're going to talk a little bit more about House Paws and some up-and-coming events that may be really useful to everybody out there that's listening. So stay tuned in, and we'll be back in just a moment.
When we make Beyond Natural dry dog and cat foods, we start with real meat as the first ingredient. We leave out corn, wheat, and soy. And we own where our dry food is made. 100%. Can other brands say all that? For nutrition you can trust and your pet will enjoy. Does your food go beyond? Learn more at purinabeyond.com.
You can't predict what a pet will bring to your life, but with a plan in front of you and veterinary pet insurance behind you, you're ready for whatever comes your way. With VPI, you're ready for anything.
Ready for anything.
When it's time for Jersey Mike's to make a really great sub, this is what we do. It's what we've been doing. It's what we've always done. It's what we'll always do. So what are you doing? Jersey Mike's. Be a sub above.
Extra Innings is the nation's premier indoor baseball and softball training center, featuring indoor batting cages, 7 multi-use tunnels, and training rooms. Extra Innings can provide professional instruction, private and group lessons, and the best year-round clinics. Along with a nationally recognized pro shop that features the latest and widest selection of equipment and apparel, our experienced staff can provide you with the right instruction and help you find the best equipment for your ability and budget. Extra Innings, where the game never ends.
Today's show has been sponsored by Farmers Insurance in Voorhees, New Jersey. To protect your assets and the people you love, call Mike Skoranek, your local Farmers Insurance agent, at 336-2553.
We are farmers. Bum, ba-dum, bum, 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 bum.
Welcome back, everybody. We're here with Protector of the Pack. I'm Dana Hoffman with Guardian Canine Training. For those of you just tuning in, we're here with Lisa Allmiller from House Paws. So, tell me a little bit about how you feel being mobile. Do you feel like you're limited?
Not really, actually. I mean, I feel like we have a lot more possibilities being mobile. We do have 2 hospitals, so we have a hospital in 2 of our locations, and we're getting a 3rd. So we have 1 hospital in Mount Laurel, 1 in Atco, and we're getting 1 shortly in Langhorne.
Wow.
So the doctors still do surgeries and stuff at the hospitals, but all of our doctors kind of have different special interests. You know, I do acupuncture, which we can do at the home.
That's amazing.
Yeah, one of our vets is a rehab veterinarian, and you know, he works at the facility. He works with us, but he also works at a facility where they do like treadmill therapy and stuff. But as far as exercising the pets post that or in between that, you can do a lot of massage or rehab work at home.
Oh, wow.
To strengthen their muscles. We do cold laser. A lot of our technicians are cold laser certified, so we do cold laser at the home. Cold laser is great for pain. It's great for inflammation. It's great for scars. It has a lot of benefits to pets.
Wow.
Just like acupuncture, we do acupuncture on everything from, you know, laryngeal paralysis to like hind leg pain and arthritis.
And you feel that it actually works, the acupuncture?
Yeah. We actually had a really cool case not too long ago. The cat had gone to a specialty clinic for allergies, and they weren't happy that the cat came back home on atopica, which is basically something that stops the immune system from working. Something like you'd go on for like organ rejection drugs.
Oh,
And
okay.
the lady had read the insert that said increases the pet's chance of cancer.
Oh.
So she came to us, and I was like, well, we can do acupuncture. So we did acupuncture and herbs, and the cat like totally, allergies totally went under control. It didn't do well with allergy shots before. It didn't do good with steroids before. It didn't do good with cyclosporine before.
Wow.
You know, so acupuncture is really neat. It's really neat in how it works for pets. I mean, they have scientific studies that show that it works by increasing your immune system. Like it's almost like I tell people, if you watch yourself have a splinter, you see an immune reaction happen there.
Right.
You see that like your body's fighting that little infection.
Yeah.
So when you stick needles into someone, you know, or a pet or anybody, your body notices that as foreign, and it sends red blood cells there and white blood
Wow.
cells there, and like nerve endings get stimulated, and you know, mast cells go to the area, and then there's also like a whole hormone channel in lymphatics. So you kind of trigger like all kinds of things. So they have studies that show that your endorphins go up, your dopamines go up, your serotonins go up, you know, endorphins, like all your good hormones kick in.
Wow.
And then on top of that, you got all this immune stuff happening, you know, that helps the body heal. So, and then the Chinese part, if you add the Chinese part in, you're stimulating the qi channels, like the lung channel or the spleen channel or the liver channel.
Wow.
You know, so you can, you know, but I just came from a house right before this. The cat was vomiting as a Siamese, and the only thing we did on it was acupuncture and B12, and the cat, who had vomiting for like 3 years before we saw it, got better. The cat was not good with oral medicine, and the owner wasn't good giving it. So for her, you know, going through a series of 6 acupunctures help, and you know, only thing the owner does now is give it B12 once a month.
Oh,
so,
wow.
A shot of B12.
So how often, when you do an acupuncture on an animal, how long does it go on for? Like, what's your typical treatment plan?
It depends. Acute stuff, you can get, like acute illnesses, you can get them to get better pretty quickly. I usually always recommend 3 sessions.
3.
I've had patients where they do 1 session and they're fine. You know, like they don't have to they come back for the second one basically to be released. If it's a chronic problem, like they have hip dysplasia, you know, like your goal is to make them live more comfortable
Right.
and better, and then to extend the treatments out. So a lot of those pets we might see initially like every, you know, like the first week, and then 2 weeks later, and then 4 weeks later. And then if the pet goes good, we'll go to 6, we'll go to 8, we'll go to 3 months, you know, and then maybe we'll stay at 3 months. Because part of acupuncture is also balancing the body for health,
Wow.
you know. So we see a lot of cancer patients, you know. We also do doggy pot at our clinic. It's marijuana without the THC, or it's derived from marijuana without the THC, but there's a lot of cancer patients that see a response, especially
Wow.
like lymphoma, seizures, inflammatory bowel disease, anxiety. so, you know, we use that on some patients, and some owners would rather use that than like steroids or
the
phenobarbital.
medications.
You know, like they
okay.
feel more comfortable. So we usually give our clients an option, like here's the pharmaceutical option, here's the herbal option, and if one doesn't work,
We'll
then
try
we try
the
something
other
else.
one.
You
That's
know,
awesome.
and sometimes you have to use real drugs, and sometimes you can get away with herbs, and sometimes you can do something in between. But we also do stem cell therapy, which is where you harvest fat, and then from the fat they can get stem cells, which are cells that don't know what they want to be yet, and then you can use them to seek inflammation and basically heal joints. My dog gets stem cell when I got adopted him, he had a broken back, pelvis, and knee, and he gets stem cell injections about every 7 months.
Wow.
Once you harvest it, they keep it, and they can keep creating more stem cells from it, and it keeps him off of like Rimadyl. When I got him, he was 2 years old, and he was on Rimadyl, Tramadol,
Wow.
like drugs that would have had to have him, you know, get blood work done every 4 to 6 months
Right.
to check his liver and his kidney and stuff like that. So I think stem cells are a really new up and coming thing, and the best thing is a lot of pet insurance companies will pay for these things, you know, like acupuncture, stem cell, cold laser, rehab, on top of all the regular stuff, chemotherapy, you know, pet insurance companies are paying for that. So if you get a good pet insurance company, and the key thing is that you get it before your pet is sick.
Right, yeah, because
You know?
some people try to get it after and then they get denied the claim. So
Yeah.
what you're telling everybody pretty much is to
Get
get
it.
pet insurance when the pet is not sick or when they're young.
Yeah, and like True Panion is one that we use at our hospital. That pays for 90% of all non-well care.
90%,
All
wow.
non-well care. So it won't pay for your dog to get spayed, or won't pay for your
Right.
dog to get a routine dentistry. But if it's got like gingivitis and needs an extraction, you know, it pays 90% of that.
That's
if it needs
awesome.
stem cell, which is $4,000,
Wow.
we'll pay for 90% of that.
That's amazing.
You know?
So True Panion you think is a good,
I think there's a bunch of good ones. That's one of the ones I like, and the main reason I like that one is because some people are so like caught up in the cost.
yes.
True Panion there's no like, or some people like, if they have 3 options, they always go for the middle, and then
Right.
something really bad happens, and maybe chemo is in the 3rd option.
Oh,
And
yeah.
they're like, man, I've been paying for it my whole life, and I didn't get the Gold Plus version, you know. So
Right.
True Panion is 90% of everything, but you get to pick your deductible.
Oh.
So you can have $1,000 deductible a month, you know, and that's a lot cheaper. You can have a $0 deductible, and that's more expensive. But I think it gives people flexibility,
Yeah, that's a good
and then
option.
they're covered for everything, you know. So, but there's like several good ones. You know, I have clients that use all different types of pet insurance. I think it's just important to call the insurance company. And the other important thing is to make sure that like the next year, like say I get thyroid disease, my dog gets thyroid disease this year, my cat gets thyroid disease this year. Next year, are they going to exclude it and say, oh, can't do thyroid anymore?
Right.
Like that's not a good company. A good company will support your pet through the
Right.
life of the pet for their problems that pop up.
So in your experience, you've had a good success rate with True Panion though.
Oh yeah.
So far, you feel like you can
Yes.
count on them.
If I could have every pet have pet insurance, get microchipped, and their owners brush their teeth, I'd be a happy pet.
So you'd be the happiest vet in the world if we can all do
Brush
that.
your teeth, get microchipped, and get health insurance.
That's awesome. Awesome. Is there any tips that maybe you have for people for helping keep their pets safe? Is there any like words of the wise that you could give to anybody listening? Some things that you could share with people?
I mean, really, I think just what we talked about earlier, no matter who your vet is, I think the most important thing you can do is have a good relationship with the vet and view them as your preventative
Partner.
educator.
Yeah.
You know, I don't think your vet should tell you what to do. I think your vet should be a partner in your pet's health care.
To guide
And
you.
they should guide you, and I think twice yearly visits are, I think getting visits twice a year are so important. And the things that your vets are recommending, like poop and pee samples. I just saw a dog today that's having surgery tomorrow. He's 2 years old, his bladder's full of stones, all the way down his urethra. He's going to have to get a bladder surgery tomorrow, and we're going to have to do a urethrostomy, which is where we cut into his urethra
Oh,
to make a
gee.
hole. And then he's got to go on the right food. But, you know, if that pet had been seeing a vet that recommended routine urines,
Could have prevented it.
yeah, but it's tough because I know a lot of people are like, "There's no problem right now. Why do I need
Right.
a fecal? My dog's never had worms before, you know." But when you get whipworms in your soil, you know, when that does happen, like it's impossible to get out.
Right. So you want
Yeah.
to. So pretty much what we want everyone to know today from watching the show is prevention is easier than
treating.
So we want to prevent all these things from happening to our pets, and I think that we can do that, like Lisa was telling us, by keeping in contact with a vet that we trust and to act as our partner and our guide in pet care and wellness. So Lisa, if you could, why don't you let people know, how they can get a hold of you if they want you to be their new guide and partner. They can contact you, and maybe you can guide them to acupuncture or all these amazing things that they offer now for animals. Let them know how they can reach you.
Sure. We're House Paws Mobile Veterinary Service, www.housepawsmobilevet.com. We're on Facebook. You can check us out on, the internet. You can call us, 856-234-5230. But, I think the best thing is having just a partner that you trust and that looks at your pet like an individual.
I absolutely agree. Well, thank you so much for coming on to the show today. Once again, everybody, this was Protector of the Pack. I'm Dana Hoffman with Guardian Canine, and this was Lisa All Miller with House Paws. Have a good day.